Our program, titled Hearts for Hearts, is a Mississippi heart disease prevention program. The topic covered here is heart disease, and the target population for the program is African American women aged 45 to 65 that must live in Jackson, Mississippi, or other surrounding urban areas. They must also have a body mass index of 25 or higher, indicating that they are overweight, and they must have a blood pressure over 140/90 or be diagnosed with hypertension. The setting will take place in Jackson, Mississippi, and the type of prevention is going to be primary prevention. To go more into detail, our program will include informational sessions that are held once a week for 6 months. These sessions will be taught by healthcare professionals, nutritionalists, dietitians, physical activity directors, and other leaders within the community, and they will be hosted in places that the target population normally gathers, like churches, fitness centers, and other public community areas. The program will not just consist of informational sessions, but there will also be group discussions, physical activity sessions, healthy eating workshops included with the nutritious cookbook, and each program participant will receive a pamphlet with additional resources. In order to recruit our target population, emails, flyers, brochures, church bulletins, informational booths at community events, and word of mouth will be utilized to make people aware of what our program is all about.
Our program, Hearts for Hearts, is targeting African American women between the ages of 45 and 65 because based on the CDC data from 2020, non-Hispanic Black women had the highest number of deaths caused by heart disease compared to other races presented on this graph. Risk factors for heart disease include high blood pressure, obesity, and diabetes. These risk factors are more prevalent in the non-Hispanic Black women compared to other groups within the U.S., which correlates to the high diagnoses and death rate of heart disease among these individuals. The high mortality rates among the specific group indicates a need for a health intervention, and our program would be a primary intervention in order to reduce risk factors for heart disease. We chose to locate our program in Jackson, Mississippi, and the surrounding urban areas due to the CDC data of heart disease death rates from the years 2014 to 2016. As you can see on the map on the top, there is a high death rate per county in the southern United States, especially in states like Mississippi, where almost every single county has the high death rate proportion, which is at 426.6 to 1,170.5 deaths per 100,000 residents. On the map on the bottom, you can see that based on the 2020 census data, 25% or more of the residents of Mississippi identify as Black or African American. The high percentage of Black or African American residents in the state correlates to the high mortality rates due to heart disease in this state. This shows a need for a health intervention to reduce the prevalence of heart disease-related deaths among this population. Also, the cost of treatment and management for heart disease is on average of $18,953 per year. This is very costly and unaffordable for many people, especially those without health insurance or government assistance. Intervening early will help reduce risk factors and prevent the need for steep medical bills, which will be accomplished through our primary intervention program.
Moving on to literature review. So we reviewed about 10 programs, and these programs were published from 2015 to 2021 for our participants and recruitment. Most of the participants were recruited throughout the community in ways such as media, word of mouth, or flyers. And these participants were African American. That is what the study is based on, and with a BMI of over 25. They were also ranged from 30 to 65-year-old on average. The theory used in the effective ones were social cognitive theory, which consisted of self-efficacy and changes in behavior and knowledge throughout the intervention. For the components, in-person activities and meetings to get participants involved were most effective. Most of the intervention focused on nutrition and physical activity in order to raise awareness and reduce the risks of heart disease. So these interventions mostly consisted of at least 12-week interventions so that the participants had enough time to go through the intervention and show change. For the pre and post test, this was used to test effectiveness of the intervention, and most of them were tests that tested for cardiovascular disease factors such as BMI, blood pressure. Some even recorded physical activity level and the diet they were on. There were a few limitations throughout the interventions, one being having a small sample size. There was not enough data throughout the sample size to collect and test for effectiveness. Insufficient data measures were not properly used, and the data from the participants were not effectively analyzed. Also, short interventions, such as anything lower than 12 weeks, often found that there was no effectiveness after the intervention. For weaknesses throughout the intervention, there was not much monitoring except for by the coordinator or through self-assessed questionnaires and surveys, which could easily be skewed because of the participants' untruthfulness or simply not understanding the question.
Hi everybody, so moving on to our next slide, we have our logic model. So this logic model pretty much maps out what we envision our program Mississippi Hearts for Hearts to look like. So starting off, the context for the creation of this program points to the larger issue of heart disease as a whole. Heart disease is the number one leading cause of death for men, women, and people of most racial and ethnic groups in the United States. That brings us to our larger priority population, which in this case would be African American women aged 40 to 65. As mentioned before, heart disease is the number one killer for African American women in the United States, and estimates show that around 50% of African American women aged 20 or older have some form of a cardiovascular disease. Knowing our priority population, what we are inputting into this program includes a number of staff. This staff ranges from a local cardiologist to guide education matters and to be directed to in times where extreme care is needed or when references are needed. We also will provide or input volunteer staff, again local as well, to help conduct screenings, to help set up events, to promote our community and our activities and our program, and just as a whole to build good repertoire with the community of Jackson, Mississippi. We also envision obtaining help and assistance from local churches and church leaders because we recognize that the church has a large influence within the Black community, so it would be in our best interest to utilize their help for our program. We also expect to get aid and funds and stuff from different associations and organizations. So some, for example, would be the Association of Black Cardiologists, the American Heart Association, as well as different sectors from the U.S. Department of Public Health and Human Services. Moving on to our output, so what we envision to do, the main thing would be to provide screenings, so things such as body weight, BMI, conducting blood pressure screenings, cholesterol screenings, and if time and resources permit, electrocardiogram screenings as well. Again, for Black women aged 40 to 65. So for participants who are deemed in the risk of having heart disease or in early stages of some form of heart disease, they are invited to weekly group sessions, again hosted at the local churches, in which they meet with a cardiologist, a nutritionist, and or a lifestyle coach to envision a map where they can better their health. Monthly community events will also be done as well, and ties to local healthcare facilities are also incorporated into our program in order to direct those in need of further assistance or treatment to appropriate resources. Now, as far as our outcomes go, what we envision for learning, the targeted population will have a greater awareness of heart disease prevention methods. They will understand risk factors associated with the illness and understand again and learn about the importance of physical activity, regular heart screenings, and healthy eating. As far as action goes, we hope that the women of Jackson, Mississippi will regularly partake in activities like screenings and things like exercises or healthy eating as well. And as far as conditions go, we hoped to see that the rate of heart disease will decrease amongst Black women aged 40 to 65 in Jackson, Mississippi, and that just the overall condition of cardiovascular health will grow.
Looking at our 3 impact objectives, this basically is trying to show you our 3 missions on how we plan on lowering the risk of cardiovascular disease amongst African American women in Jacksonville, Mississippi. So looking at number one, it's basically it. Our first objective is to reduce the onset of cardiovascular disease amongst African American women in Jacksonville, Mississippi, aged 45 to 65 by 10%. So that gives us a good goal, one that's achievable and very specific for that specific group by 10%. So we can do this by measuring their BMI, their blood pressure, and these can all be indicative of cardiovascular health. Looking at number two, we want the expansion of Hearts for Hearts program, which is our program, into at least 2 other southern states that are disproportionately affected with heart disease rates amongst African Americans age 45 to 65. So looking at this objective, you can see that we are trying to expand our program into other southern states because they have similar populations, and more specifically, those that are disproportionately affected with heart disease amongst African Americans specifically. So not just African American women, but we could include men now because we're expanding, but we still keep the age groups 45 to 65. And looking at number 3, we're planning to administer a pre and post test to assess knowledge improvement regarding cardiovascular health by 10%. This is another achievable goal that's quantitative. So if we give a test and we're trying to assess their knowledge, we can ask them questions about blood pressure, BMI, the levels of being overweight, the effects of cardiovascular disease. They can write all these things down and compare them pre and post test, and we can see their knowledge assessment. And we can quantify things as well, like how many times should you go see a doctor in a year? How many physicals should you have? Have you gone to a physical? These all kind of things. They also kind of relate to the number one, because for the first one, where we're trying to reduce the onset of cardiovascular disease, we can also do a behavioral assessment, and that one could also be a pre and post test.